Hey everyone, Dr. Jeff Williams here with Creekstone Integrated Care. I'm stopping in today to lay some information on you and also let you know we're still here. We're not going anywhere and we can't wait until you get back. We all have lots of questions around this virus, so I wanted to try to get some of them answered for you. I love being a source of good, smart, responsible information. First, I got to let you know, I'm not an epidemiologist, so I'm not making stuff up. I like to refer to the experts on the matter, and the most notable of which right now is probably our nation's greatest expert on the COVID-19 virus, and that is the head of the National Institute of Allergy and Infectious Diseases. His name is Dr. Anthony Fauci, and if you've been following any of this stuff, you probably recognize that name. He's had 1 million interviews recently, and he has to be exhausted, I can only imagine. But I wanted to try to boil down all of the information he's been dispersing throughout these interviews and boil it down into one resource for you. I may not hit all of the biggest questions, but I bet we get some of them answered right here. So here we go. What makes this coronavirus any different than all of the other viruses we've encountered? And so what he says is, well, there's a few things. For one, it's about 10 times deadlier than the common flu. And then consider that it's respiratory and it can be spread by asymptomatics, meaning people are spreading the disease without any signs or symptoms. That's a little scary. And then look at the dormancy of it. It can lie dormant for up to approximately 2 weeks, but on average, it's about 5 days. What is the easiest way to catch this nasty virus? Well, there are different degrees of risk for all kinds of ways to catch it. But by far, the most common way is from a sneeze or a cough. Sneezes and coughs cause droplets that fall onto the nose, the eyes, the mouths of people. And rather than droplets, there is a risk of the virus hanging around in the air a little bit in a form called aerosol form. A person could potentially enter an elevator after someone emitted the aerosol form and catch it that way. But although that's scary, it is honestly not the primary way people are getting this. What is the primary way is really the droplets plus a lack of hand cleanliness. Now, I know we've heard wash your hands, but here it is. It gets transferred commonly through handshaking, so it's good to just cut that out right now. Let's just don't do that, especially right now. If someone gets mad at you these days for not shaking their hands, well then that just tells you a little bit about them and their level of knowledge right now. So we should go about our day in general as if we have it, and our goal is to not pass it on. So remember, 4 out of 5 cases have been passed to others by people who have no symptoms at all. So behave as if you have it. Doorknobs, door handles. Someone can sneeze in their hand and then go open the door either in their house or out in the public. 15 to 20 minutes later, Nancy or your mom or your brother or your kid comes by and grabs that doorknob. And a little later, maybe they rub their eye. I mean, it's really that simple. So if all of us are consistent with hand washing, the likelihood here is dramatically reduced on both ends of it, both the carrier and the potential target or receiver. Now, what about receiving packages from delivery services like UPS, Amazon, and things like that? Well, Dr. Fauci says he sees no reason to get completely obsessed with receiving packages. And while we know the virus can live on cardboard a short time, again, there is in no way the primary way that people are getting it. Separate from Dr. Fauci, I've seen mentioned that one could always place the boxes outside if there are no perishables in the boxes and just let them sit there for a day and then bring them in and open them. And I've seen where people are wiping them down with bleach wipe before opening and then washing hands and discarding the boxes immediately. And you have to do things to your level of comfort and according to your peace of mind. But in general, Dr. Fauci says receiving packages is not something that he feels like we should be getting worked up about. Okay, another question. Can young people that get it become critical? Well, young people are not without harm here. Every once in a while, there will be a young person that becomes critical and has a hard time with this disease. If young people are thinking that they're invulnerable, he says they're incorrect. They've noticed particular harms in infants under a year old as well. And Dr. Fauci goes on to talk about young people that are cavalier about it, and they go home, they're being irresponsible and passing it on to parents and uncles and grandparents, and some of those folks, they're going to inevitably get it, and some of them will die. He says young people have a responsibility to protect themselves because this can harm them significantly, but they also have a societal and moral responsibility to protect other people. So, okay, how about medications like hydroxychloroquine? Are there any treatments that are showing effectiveness? Well, right now he says there are not proven safe and effective direct therapy. There's none of that. But there are clinical trials that are trying to answer what works and what doesn't, what is safe and what is not. Now, there are some medications like hydroxychloroquine that have shown some improvement, but it has not been proven yet. And so but right now they're certainly running clinical trials, and they're testing it out. Hopefully the information will be coming in sooner rather than later. Another question, is there a timetable on this thing? Dr. Fauci says the virus is the clock. And 2 weeks this and 2 weeks that is really fairly arbitrary. You can't predict when the virus peaks, and you can't predict when it wanes from area to area. Some areas are more clustered and some more spread out. You can't really expect what is happening in New York to happen necessarily in Nebraska or Wyoming, for example. The cycle that has been fairly consistent globally tends to look like about an 8-week cycle in general. Now, next question. Once you get it and get over it, are you now immune to catching it again? And Dr. Fauci again says that while there is no firm proof of it, he would almost bet the farm that once your body kicks the virus, it won't harm you again. He said, assuming it behaves like every other virus ever known to man, yes, he'd bet the farm that you cannot get it again. So, there you go, straight from the horse's mouth, as they say. Of course, most of us are all stressed here. We're worried about ourselves and our families and our businesses and our neighbors. How could we not be worried about these things? But in the end, let's have some hope, okay? 80% of patients do just fine with mild to sometimes moderate symptoms that are all very manageable from your house. If you're showing any of them, lock yourself in a room, reserve one bathroom to only you, and make sure that whoever your caregiver is taking proper precautions. But most of the cases are manageable at home. A smaller percentage, they'll go to the hospital. And a much, much smaller percentage, only about 3%, if even that, need ICU care. And that means that 97% of patients with this disease avoid the ICU and all the terrible stuff that we're seeing and hearing on TV right now. That's 97%, folks. Those are some pretty great odds. You take that in Las Vegas any day. Now, can you imagine the appreciation we're going to have for the lives that we have when we can get back to some sort of normalcy? Things that we didn't necessarily appreciate before may have a whole new shine to them. We miss you, and here's to wishing you the very best. We hope you're missing us. Continue taking very, very good care of yourselves and your neighbors. We're all in this together. And don't forget, if you need me, if you have some pain, I am available. Just call me at 355-3000, 806-355-3000, or email me at creekstonecare@gmail.com from anywhere in the state of Texas. And we can set up a telehealth appointment for you, and we can try to figure out what's causing your issue and try to get rid of it. I sure do appreciate you guys. Again, we miss you. Take care of yourselves.